Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. If this is your first time, please make sure you subscribe to the channel and turn on the notification bell, and anytime I upload a video, you'll be notified and you'll come straight here and take a look at whatever video that I have posted. I talk a lot about the mental health Osce, which is what I'm going to be doing today. The video is going to be very short today. People have been asking of the evaluation station. They want me to practically do it using the S-bar for them to see how it is actually done. I have a video on the overview of it, and today I am going to practically do it for you to see how the evaluation station is done in the mental health Osce. I do not have a friend with me here today, so I'm going to try and clone myself as the assessor and then as the student as well, and then I'll use that to demonstrate to you how you can do your evaluation station in the mental health Osce. As you already know, the evaluation station is an 8-minute station, which is more or less like a combination of a silent and then an oral. So when you start the station, you are given back all your documentations right from the assessment to the planning to the implementation. And now you are also given the S-bar sheet, which is the situation, the background, the assessment, and then the recommendation sheet. And then you can make notes on it. And when you are ready to hand over, you can alert the assessor that you are ready to hand over. And then the assessor is going to sit and listen to you hand over your patient to the assessor. The last time I said in the evaluation station that there could be so many scenarios in which you'll be handing over your patient. It could be that you are the nurse on the ward and the patient has been on the ward for some time now. It could be an acute ward. The patient has been treated and is well and is being discharged into the community. So in this case, you will be handing over the patient to a CPN or a community practitioner, which is one of the situations. Or it could be that you are on the ward, the patient is on the ward, and now you came for a morning shift, and then the night nurse has come in and you are handing over the patient to the night nurse. Or it could also be that the patient is on one mental health ward and then you are handing over to another mental health ward. It could be neurological to secure services, from secure services to neurological, or from any specialty at all within the mental health to another specialty. All these are very, very possible. So when you are given your scenario, make sure that you read and understand your scenario very, very well before you even start your handing over. It's quite a very simple procedure or a very simple station that you should not fail in any circumstance, because all your documentations are given back to you, and right from your assessment to your implementation, you should be able to hand over whatever you have done to the next person or to whoever is taking over from you. So without wasting much time, let's just go straight into the video where I demonstrate how I'm going to hand over a patient to the assessor. As I said, there is nobody here. I'm just the only person, so I'm going to try as much as possible to clone myself, and one of me will be the assessor, one of myself is going to be the student. Without wasting my time, let's go straight into the video. So I'm going to start my station by reading my scenario. Enosh Fragrance was referred by the GP to the primary health care team to go to his home for an assessment 3 weeks ago for low mood, social isolation, and suicidal ideation. A mental health assessment was carried out at Enosh's home, and Enosh agreed for a short admission on the acute mental health ward. He has been treated and his mental health has significantly improved. He self-administers his medication without any issue, and he has now agreed to work with the community team, and based on this, he's been discharged. His sertraline has been increased from 100 milligrams to 200 milligrams daily. Cholecalciferol 800 units daily basis has been added to his medication now. As the mental health nurse on the ward, hand over Enosh to the community team for continuity of care. Assessor, I am ready to hand over my patient now. Okay. My name is Enos Achana. I'm one of the nurses on the acute mental health ward here, and I would be handing over Enos Fragrance, date of birth 5th July 1993, his address 1 Suite Road, Manchester, MCH 34. His GP is Dr. Jackson, The Plains Surgery, Manchester. I would be handing over Enos because he's been discharged. He's been here for the past 3 weeks. His mental health has significantly improved. He's very concordant with his medication now, and he has now agreed to work with the community mental health team from home. So Enosh, as I said, I'll be handing over Enosh Fragrance, date of birth 5th July 1993. His address is 1 Sweet Street, Manchester, MCH 34. His GP is Dr. Jackson, The Plains Surgery, Manchester. His presenting complaints at the time of assessment was that he was experiencing low mood, and then he was self-isolating and was not interested in doing anything. He usually locked up himself in his room all day and does not engage in any activity in the house. Enosh tried self-harming himself by jumping out of a speeding car. Enosh did not have much sleep, as he usually take energy drinks at night and stay out throughout the night. His family felt he could self-harm again and were unable to help him. Therefore, they referred him 3 weeks ago to the GP for an assessment, for which the GP also referred him to the mental health team in the community, where an assessment was carried out in his house. In terms of his past medical history, he had depression in the year 2005, which he was admitted for about some few days and then was discharged back into the community. He's also a known diabetic, and he also has acne. In terms of social history, he's never been married, he has no children, he lives with his mother, who is in a wheelchair in the community. He has no pet, no dependent. Enosh has been the head teacher of a secondary school for the past 5 years now, and then he used to enjoy his work, even though he's been off sick leave for the past 8 weeks now. He's a non-smoker and he does not drink. Before he was admitted on the ward, he was on these medications: sertraline 100 milligrams once a day, ferrous gluconate 230 milligrams twice a day, metformin 500 milligrams on daily basis. He is not allergic to anything, no known allergy as it stands now. So in terms of assessment, Enosh was referred to the community team 3 weeks ago, where the community mental health nurse visited his house for a thorough mental health assessment. During the assessment, a PHQ-9 was used to assess the severity of his depression. He scored a 19 out of 27, which gave a provisional diagnosis of major depression, which was moderately severe. An outcome of the assessment was that he was having thoughts of self-harming, he was having problems of sleep, he was having problems with regards to nutrition, and then he wasn't also sleeping, as I had said earlier on. There was also some few risk factors that were also discovered during the assessment. He had risks of self-harming, risk for malnutrition, difficulty in sleeping, and was also experiencing severe low mood, which usually comes with thoughts of self-harming. Based on these risk factors, it was discovered that he did not have any insight into his mental health condition, and as a result, he did not have the capacity to keep himself safe in the community, even with the support of his family. As a result of this, a short admission was suggested to Enosh on the community, which he agreed and consented to this admission, and therefore he came onto the ward as an informal patient. On the ward, there were a couple of problems that were discovered. The very first one was with regards to low mood. With the low mood, a care plan was drawn around this problem, which all aspect of his care was explained to him on daily basis. His mental health status was also assessed, his behavior, his thought, his feelings. Aside that, he was also offered one-to-one sections every day on the ward or every shift for us to be able to support him. And with this, he was able to ventilate his thoughts, his feelings to the nurses. His prescribed medications here was also administered on every shift. He was referred to the ward psychologist who helped with some talking therapies, as well as the ward psychiatrist who also helped to review his medications. On the ward, he was shown the protocol anytime he wanted to approach a nursing staff, or anytime he wanted to talk to a nurse. He was shown how to do that, either by the use of the call bell when he is in his room, or approach any nursing staff on the ward to talk to. Aside this, there was also a problem around nutrition, where he was referred to the ward dietitian. His likes and dislikes was assessed, and a preferred meal was always served here on the ward for him. Aside that, he was also experiencing sleep problems, where we tried as much as possible to discourage him from taking the energy drinks that he used to take when he was on the community. In fact, a care plan was drawn around that, and he could only have one energy drink in a day to help support with his sleep. He was also taught on how to have a warm shower, how to sleep in loose clothing at night, so that he'll be able to have adequate sleep. Aside that, a rest period or a sleep well period at night was allowed, so that within the hours of 12 to 6 o'clock in the morning, nobody disturbs him whilst he is sleeping. His mental health has significantly improved with these nursing interventions that we put in place whilst on the ward, and he's been very, very concordant with his medications. As it stands now, he self-administers his medications without any issues at all on the ward, and he has agreed to work with the community health team, hence the reason for handing him over to the community health team. In terms of medication, his sertraline has been increased from 100 milligrams to 200 milligrams. He's still on his ferrous gluconate 230 milligrams twice a day. His metformin 500 milligrams for his weight management and his diabetes as well is also still in place, 500 milligrams on daily basis. And of course, glucosate sodium has also been added to his medications. In terms of recommendations, I would recommend that you try as much as possible to involve his family on the community to help to prompt him to take his medications, even though he self-administers, but on daily basis he need prompting to be able to take his medications. His or sometimes on the ward has also expressed thoughts of self-harm, which he says is not serious about it, but then I would recommend that you involve the family to always look out for that, just in case he has these thoughts and is willing to act on them. I will also recommend that you refer him to the community psychologists and psychiatrists for both medication review and talking therapies as and when he needs them. And then you can also introduce him to some mental health groups in the community who would help to support him when he needs support. You can also try as much as possible to introduce the emergency lines to him anytime he's having thought of self-harm and is willing to act on them, to call these numbers for a swift response. So this is Enoch Fragrance, who I am handing over to you for continuity of care in the community. Please, do you have any questions regarding Enoch Fragrance? No, I don't have any questions. If there are any questions, we'll call the ward and let you know. Thank you very much. In that case, that is Enoch Fragrance, and I would end my evaluation station here. Thank you very much. Alright, thank you very much for watching the video. I hope the video was insightful. Please, if you have not subscribed to the channel, make sure you subscribe to the channel and turn on the notification bell, and anytime I upload the video, you'll be notified and you'll come straight here and watch the video. I'm still struggling to get 1,000 subscribers. The messages I do get on emails is more than the views I'm getting. Please make sure you subscribe. If you've also subscribed, make sure you share to other people or other mental health nurses who have come to the UK to come and have their Osces. Make sure you share it to them so that they also see the video. I'm very happy because I've got a lot of people in the comment section who are taking their exams on the first attempt and then they are passing just by watching the videos. And thank you guys for always coming back to comment under the videos that you watched the videos, you took the exams, and then you have passed. My name is Enos and this is Work and Wonder. See you in my next video. Bye.